Good morning. How you doing? This is Rich here on behalf of Rich TV Live, and I have another secret stock special pick that I wanted to bring to your attention, that I need to put on your radar, that I need you to put on your watch list right now, right here, right now. We've been absolutely on fire here on Rich TV Live. Like, everything we've been talking about has been doing extremely well. So I wanted to congratulate members on all of your success so far here in 2020. Hopefully we can continue and maintain this winning percentage and beyond. This is a company that I think has the potential to be a good one. It's called Premier Health Group, Inc. And this is like the future of medicine. Okay? So I want to show you why. So the symbol is PHGI in Canada, PHGRF in America. That's what the symbol looks like here. The low for the last year is 24 cents. The high is $1.02, and we're currently at 46 cents. So there's a long ways to go back to its original high. That's the symbol in Canada. The symbol in the US, PHGRF. I want to show you why I like this. Now, there's a really big telemedicine company that I like a lot. It's called Telehealth. I've told you guys about them. They have been absolutely on fire. They're one of my favorite companies for 2020. And this company kind of reminds me of Telehealth. And I actually spoke with the CEO of PHGI, and he actually did compare his company to TDOC. Now, TDOC is a $94 stock on the New York Stock Exchange. PHGI is nothing close to that price. But imagine if one day they got to $94. So at 46 cents, comparing them to TDOC is pretty interesting comparable. Now let's break down what Telehealth Services does. Let's just break this down. This is their investor presentation. This is the management team. As you can see, a lot of doctors. Let's break it down. Company overview. Premier Health is a healthcare technology company that is strategically poised to take advantage of the 10 trillion untapped virtual care market. We are developing an innovative healthcare platform with a patient-centric focus that places the power back in the hands of patients. So essentially what they're doing is, you're a patient, you can get access to medical clinics, pharmacies, and allied health professionals all over the phone. This is the new wave. People don't even have to leave their homes to get treated, to get medicated. And this is the future of medicine as far as I'm concerned. I wonder if you guys have ever heard of this company before. Good morning, guys. How you guys doing? How you doing, Christopher? How you doing, Hi Cham? How you doing, Fat Nuts? How you doing, Jose? So, healthcare systems are broken. Canada continues to underperform below the international average for timely access to primary healthcare. Whenever you go to a doctor here, sometimes they even close clinics. Sometimes they're super busy. If you ever need to go to emergency, unless you're dying, you're probably waiting at least an hour to 2 hours to get in. So what they're doing here, I think, is pretty smart. They're giving you the ability to get a hold of a doctor over the phone. And I think this will be good because this will reduce a lot of the people that are going to the doctor for like the common cold. And I see that as a major issue here in Canada. Keo Cushion Trader, how you doing, buddy? So one of the issues with healthcare is the rising costs, inefficient use of resources, doctor supply, and accessibility. Governments and payers facing increased costs that are simply unsustainable. 39% of Canadians who visit an ER indicated that they could have avoided the visit if they had better access to primary care. A shortage of primary care doctors and nurses, especially in remote and rural communities, leads to clinician burnout and patients frustrated by long wait times. Newly licensed doctors are avoiding primary care because of these dynamics, which increases the pressure on an already stressed system. Approximately 15% of Canadians aged 12 and older don't have a primary care physician. Nearly 2/3, 59% of seniors, are unable to get a same or next day appointment. Almost 7 in 10 Canadians avoid a doctor when they are sick because of long wait times, limited hours, and physical barriers to care. I was able to speak to the CEO and I was really impressed with what this company's doing. The revenue growth is going to be spectacular with this company, guys. Solution, My Health Access Patient Portal app. 24/7 real-time online booking, followed by a confirmation and reminder system. So this is an online app that gives you access to physicians. Review medical chart and lab results in real time. Secure chat with professionals, with medical professionals. Connect health monitoring devices. AI virtual assistant will be able to assist the patient, perform tasks such as taking history and triaging for the doctor. Skip the waiting room and see physician from the comfort of home or office via telemedicine. The future of medicine is over the phone through apps and artificial intelligence. Reorder prescriptions and have delivered directly to their door. One of the issues that I have right now is being from Toronto. I had an issue with my back many, many years ago. And if I go to a doctor here, they want an x-ray. Well, I got to call Toronto. I got to go find my doctor. I got to get old x-rays and I got to get them sent. What they're trying to do here is have a one-stop shop for everything. So their app is going to have a lot of technology and a lot of intelligence. So when you go on that app, you're going to be able to have all your information uploaded into one place. So when you go onto that app and a physician is looking to help you, they can pull up your entire file. They can see everything that's wrong with you. They can see all your prescriptions. They can see your records. They can see your x-rays. Everything will be in one place. So it will be a one-stop shop for all of your medical needs. It's a great idea. So you don't have to go here for this, there for that, and try to figure out where all of your information is for your history. They want to be able to put it all in one place to make it very easy for a physician, for a doctor, for someone to help you with whatever you need help with. You need prescriptions, it's going to be there. You've got x-rays, you need, photos of your x-rays, it'll be there. You've had a history of allergies, you're allergic to ragweed, you're allergic to chocolate, it'll be there. So this is one-stop shop. This is the future of medicine, and PHGI is just getting started. This is a company that has incredible potential, guys. You have no idea. Just because you haven't heard of it doesn't mean it's not going to be a giant. I promise you, okay? This is one that's going to be really big. Look at TDOC, the company I'm comparing them to. They're a giant. PHGI at only 46 cents. Remind you, TDOC is at... This is one of the biggest telemedicine companies in the world. TDOC, a $94 stock. By the way, they're up to $95.10. They're up pre-market as well. So if PHGI can even do 10% of what TDOC is, that would make them a very huge success. They're at 46 cents. Imagine if they went to $9. You would make 20 times your money. So I really like the idea here. This is the future of medicine, guys. This is the way we're going. People don't want to leave their house anymore for anything. Look at Amazon. People don't want to go to the mall anymore. They just want to go to Amazon, do their shopping there. So what about PHGI? Is this the wave of the future? This is a Canadian company, guys. Phase 1 medical clinic expertise acquisition. We are focused on a vertical growth strategy that is easily scalable with low overhead. The clinics are being used as proof of concept for our remote and virtual services, i.e. nursing, virtual MOA, medical billing, and telemedicine. We have fully integrated medical clinics with 40 healthcare professionals serving over 209,000 patients. So they're already doing this, folks. This is happening. We have improved the traditional clinic model by implementing the following practices. Patients have their own primary care doctor, but can also be seen at any of our clinics thanks to centralized patient records. Genius. 24/7 online bookings to reduce calls and no-shows. Genius. Virtual visits with doctors or nurses for patient convenience and increased income for the clinics. This is additional money for clinics, additional money for physicians. They can do this business when they're slow. They can do this business after hours. They can do the business on weekends. It's only going to make physicians more money. So that's why I think this is going to blow up. The ticker is PHGI. Ticker is PHGI. Where is it? Ticker is PHGI. It's PHGI in Canada, PHGRF in America. And if we look at the 1 month chart, you can see that they've already started to climb. They've already started to climb from 26 cents all the way to as high as 50 cents, currently at 46 cents. And I'm telling you, nobody knows about these guys because I had never even heard of them before. And here we are. So phase 2, health tech expertise acquisition. Cloud Practice offers cloud-based electronic medical records, EMR, software applications for physicians throughout Canada. Cloud Practice currently has a growing team of 24, including software developers and sales staff. The team is focused on building software solutions to streamline medical practice. Cloud Practice products include Juno EMR, a cloud-based EMR solutions, which is currently used by 315 clinics across 8 provinces, over 3,000 licensed practitioners, 1,500 staff, and 2,870,000 registered patients. That's their database right now, folks. Almost 3 million patients. Clinic Aid, a medical billing software, processes upwards of $30 million in payments to over 3,000 health providers on a monthly basis. My Health Access, an online portal for patient appointments. So this company's already doing business, guys. And lots of it. But you probably never heard of it before until now. And that's really what we specialize in. We like to identify undervalued, underappreciated, underexposed opportunities before anybody else on the planet. I think this is one of those companies. Phase 3, pharmacy expertise acquisition. We are partnering with pharmacies across Canada to deliver a new model to meet the current consumer needs for prescription and non-prescription pharmaceuticals. The Premier Health platform fills a significant need for consumers. It offers more convenience as patients receive prescriptions quickly and efficiently, more accessible fulfillment options right through our app, private room that provide privacy and security at telemedicine delivery kiosks in pharmacies throughout Canada. We are partnering with pharmacies across Canada to deliver a new model to meet the current consumer needs for prescription and non-prescription pharmaceuticals. We currently have a team of 32 professionals backed by a management team with over 20 years experience in managing pharmacies. The overall goal is to bring end-to-end primary care to all our customers. Now, when I was speaking to the doctor, he actually told me that they're going to be able to have little packages that you're going to be able to get where you'll be able to take your own prescriptions. You'll be able to take your own medicine. You'll be able to take blood. You'll be able to do everything on your own. You won't need a doctor anymore. This is going to change the game. because so many people do not want to go to the doctor here in Vancouver because you got to wait in line. So yeah, we got free healthcare compared to a lot of other countries. Our healthcare system's pretty good, but you got to wait, and it's annoying, and it's frustrating, and it sucks. And this is why these guys are creating this solution, and why I think it has a great potential to be a huge winner. So some of the latest developments: IBM collaboration. Yeah, that's right, IBM collaboration. AI, artificial intelligence, powered medical office assistant, MOA. Non-patient care activities such as logistical and administrative tasks consume over half, 51%, of a nurse's workload. We want to be able to make sure that these nurses are utilizing their time more efficiently. Developing a first-of-its-kind solution in which Premier provides data from their medical clinics for IBM to build and integrate Watson as a virtual medical office assistant. Reduces clinical overhead by improving administrative workflows and eliminating time-consuming non-patient care activities for staff. Product funded and wholly owned by Premier. I'll give you an example of a conversation. Hello, my name is Avita, and I'm here to answer some of your questions. How can I help you? I need to cancel an appointment. Okay, it looks like there are 2 upcoming appointments. Please select the one that you would like to cancel. Appointment 1 is Monday, December 23rd at 11 a.m. Appointment number 2 is Tuesday, December 31st at 10 a.m. Appointment 2, Tuesday, December 31st, 2019. I've canceled your appointment on Tuesday, December 31st, 2019. Is there anything else I can help you with? That's an example of how the artificial intelligence and how the program works for you to cancel an appointment. Latest developments, live care acquisition. So this is a new acquisition that's really changed the game for Premier. Live Care Connect, secure communications platform, secure peer-to-peer video conferencing and instant messaging. Supports medical peripherals. Fully EMR agnostic and white label available. Huge. Kindred PHR secure personal health record. Co-developing with McMaster University to be fully API integrated. Patient-owned secure personal health info repository. Self-managed care team collaboration tool, i.e. invited caregivers, EMR, labs, wearable data trackers, etc. So these are some of the latest developments. Check this out. Pharmacy kiosks. Partnering with pharmacies across Canada to provide on-demand virtual care within existing pharmacy consultation rooms. Pre-configured telehealth carts to achieve real-time diagnostic input and clinical evaluations. Attached peripherals enable modified physical exams. So do you guys see what they're talking about here? I gotta move this. Do you guys see this? So they're partnering with pharmacies across Canada to provide on-demand virtual care with existing pharmacy consultation rooms. This is the future, folks. Pre-configured telehealth carts to achieve real-time diagnostic input and clinical evaluations. Attached peripherals enable modified physical exams. Like I was telling you guys, the future is you're going to be able to test yourself at your own home. You're not going to need a doctor. You're going to be able to get a kit. You're going to be able to take it home. Doctors will tell you how to use it, and you'll be able to take your own blood pressure. You'll be able to take your own blood. You'll be able to check your pulse. You'll be able to do everything. That's the future. Simple, slim kiosk that enables video only, provides 2 revenue streams, recurring monthly revenue for renting equipment, and increased foot traffic for virtual visits. This is a virtual doctor, folks. So they're going to be setting up kiosks with these virtual doctors where you're going to be able to go and speak to physicians and virtually, wherever these kiosks are set up, be able to get telemedicine and to be able to get diagnosed and to be able to get support. This is the future. No more waiting in lines for doctors, guys. Revenue model. Health tech solutions. Junior EMR, clinical aid, medical billing, My Health Access, patient portal. On-site medicine, primary care, medical clinics, pharmacies, off-site medicine, telemedicine solution accessed via My Health Access app, private rooms throughout network of pharmacies, medical services, shared nursing, medical billing, third-party partnerships, mental health counseling, allied health professionals, big data. Look at the revenue projections. This is incredible. This is incredible. So you can see the revenue projections are just skyrocketing. Everything is on the way up. Everything is on the way up. The revenue potential is phenomenal for this company. So the anticipated gross revenue of 2019 was 11.5 million. In 2020, they're anticipating 22 million. That's double, folks. In 21 million, they're anticipating 41 million. In 22 million, they're anticipating 57 million. That's incredible growth. You could see their EBITDA is also growing to 556,000 in 2019, 3.9 million this year, 2020, 11 million in 2021, and 19 million in 2022. So the revenue growth is phenomenal. As we leverage technology, the focus of our business is to continue to evolve from physical bricks and mortars to SaaS, telemedicine deployment, and outsourced services. With our main source of revenue shifting to these higher margin businesses, the total EBITDA margin increases from 12% in 2019 to 36% in 2022. So the revenue growth is phenomenal. The EBITDA growth is phenomenal. Now, take a look at some of their competitors. I talked to you guys about this already. We all know TELUS. Here's another one called Well on the TSXV. Another one called L on the TSE. And Teladoc, which I told you guys about, TDOC. Teladoc being the biggest. Let's take a look at Teladoc, TDOC. Market's opening in 5 minutes, folks. Hope you guys are ready. And it looks like a lot of companies are already green. Visa is up pre-market. MasterCard is up pre-market. Lululemon is up pre-market. Goldman Sachs is up pre-market. Home Depot is up pre-market. Facebook's up pre-market. Walt Disney's up pre-market. Beyond Meat's up pre-market. Teladoc's up pre-market. A lot of stuff up pre-market today. It's going to be, the market melt-up continues as predicted, folks. This is a very real thing. So this is TDOC. They're up pre-market. And Teladoc, global virtual care leader, recently acquired advanced medical and international telemedicine company, 6 billion market cap. So they're the biggest. Everybody wants to be like TDOC. And let's take a look at some of these others. Well, let's go Well. Well, here we go. TSXV. TSXV. Well is at $1.94. Wellness lifestyle. $1.94. Oh, QHR. Let's try QHR. QHR. Doesn't seem to find QHR. Oh, symbol L. Sorry. L. On the TSE. There it is. Loblaws? QHR Technologies. Why is it showing Loblaws? Weird. L. I guess QHR is not showing up for whatever reason. PHGI. Premier Health. So you could see it's even right now at 46 cents. The market is now opening, and let's see where it goes today. Lately, everything we've talked about has literally been flying, and that is exactly what we need. We need to see these stocks fly. That's exactly what we like. That's exactly what we need. And hopefully we will see PHGI fly today after this video, because that's kind of been the trend every time we've been going live. So you could see some of the competitors in the sector, with Teladoc being the biggest. So there's a lot of room to grow in the sector, and there's a lot of people getting into the sector because there's a need for it. You could see the growth here and all the milestones that they've achieved. Look at this. Kickoff with IBM on virtual medical office assistant. Anytime you're working with IBM, you know you're doing something right. I mean, IBM is one of the biggest, most powerful companies in the world. These guys are working with IBM. I love it. Absolutely love it. A company working with IBM, changing the world, making a difference, and they're at 46 cents. These are the types of opportunities we love to identify. And we love to identify them first. Have any of you guys ever heard of this company before? I'd love to know if anybody here that's watching has ever heard of this company before. Because I kind of take a lot of pride in showing you guys companies first. Once again, symbol PHGI in America, PHGRF, and put them on your watch list, put them on your radar. I will not be surprised to see them really make a move today, because every time we talk about anything, it seems to make a move. The future, improved patient and doctor experience. Doctor can be anywhere in the world. Doctors can choose to see patients in office, at home, or on vacation. I love that. Connected clinics across the globe. Patients can visit any clinic and have their chart follow them. Love it. I love that concept. This is a game changer. See virtual doctor through our telemedicine app website. Government funded in BC, therefore no additional cost to the patient. This isn't going to cost you anything extra, but it's going to give you so much more. Prescriptions electronically submitted to the pharmacy of their choice or delivered free to them by a preferred pharmacy partner. Use app website to book online 24/7. Time shifting will eventually allow 24/7 doctor availability. That's coming, folks. It's coming. Can we see Trulieve make up for yesterday? Yeah, absolutely. I think that you're going to see a lot of the cannabis stocks make a move, because we're coming off a bottom, clearly, and there's a long ways to go up from here. So these are their expansion plans. Currently 120,000 patients in British Columbia alone. Partnerships with indigenous communities to open telemedicine clinics. Expand to rest of Canada using same models as telemedicine billing codes. Expand overseas, i.e. telemedicine, second opinion services, licensing fees. Currently have a strategic partnership in China that is also an equity holder. Dedicated telemedicine doctors covering our telemedicine virtual clinics 24/7, vertical growth. Acquisition of key technology, example AI blockchain, pharmacy system integration. Now this is the share breakdown. This is what everybody's waiting for. Here it is. So they've got options at 56 cents, but those expire in 4 years. So the year high is $1.02. The year low is 25 cents. Market cap of 35.51 million Canadian as of January 7, 2020. Shares issued outstanding 81,213,470. Fully diluted with options and warrants and all other special situations. 92,257,334 shares issued and outstanding, fully diluted. So under 100 million shares, I think that's really tight. It's a great tight share structure. And I think that these guys are definitely positioned to do unbelievable things here in Canada. This is Premier Health. Premier Health Group, and you can see their website at premierhealth.com. Let's pull that up. This is what the website looks like. Our caring and commitment to good health extends into every corner of our community. Find a doctor, service, or location. Find a doctor. So you can see they are already doing this, folks. Pretty cool. Find a doctor, schedule services, pay my bill, classes and events, careers, my chart. Schedule your appointment online. Care that fits your needs. We know you're busy, that's why we offer convenient options so you and your family can get the care you need in a way that works for you. Emergency care. When serious illness or injury strike, get comprehensive care at our emergency centers. Primary care, urgent care, easy access, virtual centers. You have questions, we have answers. So that's the website. So let's just read this. Telehealth services is defined as a medical practitioner delivered health service provider to a patient via live image transmission of those images to a receiving medical practitioner at another approved site through the use of video technology. Video technology means the recording, reproducing, and broadcasting of live visual images utilizing a direct interactive video link with a patient. If the sender and or receiver medical practitioner are not in a health authority approved site, the medical practitioner is responsible for the confidentiality and security of all records and transmissions related to the telehealth service. In order for payment to be made, the patient must be in attendance at the sending site at the time of the video capture. Only these services which are designated as telehealth services are payable by MSP, medical services provider. Other services, procedures require face-to-face encounters. Telehealth services do not include teleradiology or teleultrasound, which are regulated by the specific sectional preambles. Telehealth services are payable only when provided as defined under the specific preamble pertaining to the service rendered. Example, telehealth consultation. See preamble number 2 to a patient with valid medical coverage. Patients must be informed and given opportunity to agree to services rendered using this modality without prejudice. Notwithstanding the above, telehealth examinations means an examination of a patient by the consultant at the receiving site using telehealth services as defined above, but does not include the face-to-face encounter requirements referred to under Preamble A. In those cases where specialist service requires a general practitioner at the patient's site to assist with the essential physical assessment without which the specialist serves would be ineffective. The specialist must indicate in the referred by field that a request was made for a general practice assisted assessment. When a receiving medical practitioner, after having provided a telehealth consultation service to a patient, decides she must examine the patient in person, the medical practitioner should claim the subsequent visit as a limited consultation unless more than 6 months has passed since the telehealth consultation. Where a telehealth service is interrupted for technical failure and is not able to be resumed within a reasonable period of time, and therefore is unable to be completed, the receiving medical practitioner should submit a claim under the appropriate miscellaneous code for independent consideration with appropriate sustaining information. Video technology service as generally payable once per patient per day per medical practitioner. Any exceptions to this policy must comply with all payment schedule criteria for multiple visits. Information regarding the medical necessity and times of service should accompany claims. Compensation for travel, scheduling, and other logistics is the responsibility of the regional health authority. Rural retention fee-for-service premiums are applicable to preamble to the guide to fees. Telehealth services are payable based on the location of the receiving medical practitioner in eligible RSA communities. The College of Physicians and Surgeons of British Columbia has confirmed that it has province license. It's defined by the location of the medical practitioner. However, other jurisdictions may have other definitions. BC medical practitioners providing care via telehealth to patients outside the province must abide by the regulations set in the patient's home province. Interesting. So, general practice, these fees cannot be correctly interpreted without reference to the preamble. Note, cosmetic surgery physicians should be familiar with guidelines for cosmetic surgery in the preamble prior to referring patients for surgery or altering of appearance, where it is clear at the time of referral that the proposed surgery for alteration of appearance would not qualify for coverage under MSP. The consultation would also not be covered. Note, daily volume payment rules applying to designated office codes. The codes to which these rules apply are as follows: office visits, office counseling, office complete examinations. The total of all billings under the codes listed that are accepted for payment by MSP will be calculated for each practitioner for each calendar day. When such a daily total exceeds 50, the practitioner's payments on these codes for that day will be discounted. Moreover, when a daily total exceeds 65, a further payment discount will be made. So you can see here the way the discount works and the way the payments work. Services will be assessed and payment discounts will be applied to services in the order in which they are received and accepted for payment by MSP. Payments discounted will not be applied to services designated by the physician as being the responsibility of ICBC, designate by checking the MVA indicator on the claim, or services that are responsibility of WorkSafe BC. So you can see that they're literally plugged into everything. They're literally plugged into MSP. They're plugged into ICBC. They're plugged into everything. This is the future of medicine. Believe it or not, this is the future of medicine. So let's just take a look at some of the stocks that are moving right now. And let's see if Premier Health will be moving today. So you can see some of the latest news. U.S. News and World Report, Miami Valley Hospital ranked 6th in Ohio. Recent awards, Premier Health, Magnet recognition. Premier Health is one of only 20 healthcare systems in the U.S. and only the second in Ohio to earn this prestigious recognition for excellence in patient care. Awards and achievements. We're dedicated to a healthier community and a healthier you, and we're proud to make a difference for the people in the communities we serve. Please take a moment and allow us to share our achievements with you. Premier Health has earned Magnet recognition as a system for the American Nurses Credentialing Center. We are one of only 20 healthcare systems in the U.S. and only the second in Ohio to receive professional nursing's highest honor. Research shows that Magnet designated hospitals provide a safer environment with better outcomes for patients, such as fewer complications and injuries, lower mortality rates, and shorter stays. As part of Premier Health's first ever system Magnet designation, Miami Valley Hospital has achieved its 4th Magnet designation since 2004. With its latest designation, the hospital joins an elite group of only 58 U.S. healthcare organizations, fewer than 1% of hospitals in the nation, to have earned 4 magnet designations. So you could see that this is expansion that is going to potentially go global. And this is just getting started. They are literally just getting started. One 125 locations in their network right now. Wow. Here's a news release that came out in November. Ontario expanding digital and virtual healthcare, giving patients more options, part of province's plan to end hallway healthcare. Yeah, people literally waiting in hallways to get health. It's pretty sad, but that's the reality of where we're at in Canada. Ontario's new digital first for health strategy will bring the patient experience into the 21st century and help end hallway healthcare by offering more choices and making healthcare simpler, easier, and more convenient for patients. At the same time, this new strategy will harness the imagination and capabilities of Ontario's digital health innovators to improve care for all Ontarians. Today, Christine Elliott, Deputy Premier and Minister of Health, was at Trillium Health Partners Credit Valley Hospital to announce the 5 pillars of the government's digital first for health strategy. Once the new strategy is fully implemented, patients can expect more virtual care options, expanding availability by video visits, and enabling other virtual care tools such as secure messaging. Additionally, providers will be able to leverage a variety of virtual care technologies that best meet the needs of their patients, expanding access to online appointment bookings. Patients will be able to book appointments that best meet their needs. Greater data access for patients. More patients will be able to review their secure health record online and make informed choices about their care. Better, more connected tools for frontline providers. More providers will be able to access patient records, stored access across multiple health service providers to provide better, faster care. Data integration and predictive analytics. Providers will face fewer barriers to integration and using secure health information to manage health resources and improve patient care. This could lead to improvements such as earlier intervention and better management of chronic diseases. This is the future, guys. It's not going to be stopped. This is happening. It's happening everywhere, all over the world. And these guys are positioned perfectly to take advantage of this new wave of healthcare, virtual healthcare. Let's see if there's any movement in America. Okay, so in America, we're up slightly, a little bit, not much. PHGRF is the symbol in America, and the symbol in Canada is PHGI. I see 31,000 shares in volume so far, currently at 46 cents. So we haven't really had a big move yet, but I will not be surprised to see some move at some point today. Now let's take a look at the overall markets because it looks as though we are having more movement today. Told you guys about Namaste yesterday. Up another almost 6% today at 44.5 cents. CanTrust is up another 5% at $1.60. My prediction is they get their license back soon. Hexo is up again. This is Hexo in America, up 3.78%. Aurora Cannabis up another 8% today. This is very bullish for the cannabis sector. Organigram is up 10% again today after being up huge yesterday. Another 10% today, up 11% now. They're absolutely flying. Nokia, one of my top picks for 5G, has been going up from $3 to $4 now since I've been talking about it. They're now at $4.14, up 2%. Afria is up so far 1.5%. Chronos Group is actually down slightly. This could be a buying opportunity for Chronos Group. CWeb is currently up 3.8% and now almost up to $11 now. They were at $8. I told you it was a buy. They are now almost at $11. Here's Nova Gold Resources, a gold stock that I've been watching very carefully. They're up slightly today. What else? Canopy Growth is up. They are green today. This is very bullish for cannabis stocks. Teledoc Services, which is a bigger version, better version of PHGI, the biggest telemedicine company that exists. $6 billion market cap. These guys are up again. And these are one of my favorite picks, and they just keep climbing. They just keep climbing. So keep your eye on them. They're a giant. Beyond Meat is up 3.5% today. They're having a nice day. Visa is in the green. Facebook is in the green. Home Depot's in the green. So the market melt-up continues, folks. Goldman Sachs is green. MasterCard is green. So lots of green today. Let's look at the marijuana index. Thank you guys for joining. If you guys have any questions or if there's anything that's running right now that you want me to look at, please let me know. As you can see, the market is melting up. Cannabis stocks are finally showing signs of life. We've waited long enough. We've suffered long enough through a really tough time for 9 months. Hopefully this can be sustained and will continue. So you can see some of the big winners today. Organigram leading the charge. Aurora followed them. Then Hexo, Fire, CanTrust, T-God. Sundial has been doing really well. Followed by Chronos Group, Afria, Labs, Valens. Those are some of the movers so far today. And I mean, it's early, obviously. And then in the United States, the market just opened, guys. So still have lots of room for things to move. And I'm sure they will. Up and down. And MedMan's making a move. Green Growth Brands making a move. Kern, Ianthus, CWeb, Vario Health. So you can see there's a lot of movement happening in the market right now. And here's Premium Health Services. And these are all the different services they're providing. So I'd love to know what you guys think. Do you guys like this company? Do you think it has a chance to be a winner? PHGI is a symbol in Canada. 46 cents. And hasn't made any big moves yet today. But I will not be surprised to see them make a move once this video gets circulated and people start to see it. People start to realize what it is. And people start to get an idea of what this company is all about. I think people are going to be very, very excited about the potential of Premier Health. I think the upside is phenomenal, and this is a new industry. It's a new sector, and I love new industries. I love new sectors, and look at this. Look at this. We are climbing in America. We are up somewhat in America. It's traded for almost 5,000 shares in America. So we have a little bit of volume in America, more in Canada, and we are slightly green in America so far. PHGRF is the symbol in America. PHGI is the symbol for Premier Health in Canada. If you guys like this video, smash the like button, comment down below, share the video everywhere. I think Premier Health has a chance to be a big winner, and I just want to make sure you remember where you heard it first from your boy Rich at Rich TV Live. I'm also going to be doing an interview later today with Delta 9. Let's take a look at Delta 9. I will be speaking to the CEO of Delta 9 Cannabis, John. And they've been flying, guys. Delta 9 up another 2% today. They've been flying from their lows. You can see their low of 37 cents. They've already close to doubled. Now it's 73 cents. So if you got in November at the bottom, you've already almost doubled your money on Delta 9. So we will, oh, there it is. There's the bump. Boom. PHGI. There it is, up 2%. It's almost like clockwork, guys. Every time I talk about a company, it's almost like clockwork. It's almost automatic. If you guys haven't noticed the trend, I talk about it, it goes up. So I really don't have anything else to say. I think this company has a lot of potential. I think that this is the future of medicine. People don't want to wait in line anymore. People don't want to leave their home for anything. People want to medicate at home. This is how they can do it. People have a question, they can call now, they can get an answer. This is the future of medicine. People don't want to go to the hospital where there's other sick people, where there's long waits, long lineups, and waste their time. People want to be able to get on the phone and get instant service. And this is the company, Premier Health, that's providing that. Thank you guys for watching. If you're not winning, you're not watching. This is your boy Rich from Rich TV Live, bringing you Premier Health first. It's true. PHGI, it's up 2% in Canada, and PHGRF in America. Yesterday, I brought you guys Namaste. They're up now 7%. They were up 9% yesterday. That is 16% in 2 days after my video. Thank you guys for watching. If you're not winning, you're not watching. Like I said, we bring in the winners, and we bring them to you first. I'm out. Peace.